Signs of HIV in women. Understanding the symptoms for better health. Imagine a whisper that could change everything. A microscopic invader that moves silently through a woman's body, leaving subtle clues that many might overlook. This is the story of HIV in women, a complex medical journey that demands our attention, understanding, and compassion. HIV's unique manifestation in women. HIV affects women differently than men, with symptoms that can be more nuanced and easily misunderstood. Unlike popular misconceptions, HIV doesn't announce itself with dramatic signs, but instead creeps through the body, leaving behind a trail of subtle health changes. HIV real-world statistics. According to data from the Centers for Disease Control and Prevention, CDC, women account for roughly 19% of all new HIV diagnoses in the United States. This statistic highlights a significant public health issue, particularly among certain demographics. Notably, African American and Hispanic women are disproportionately impacted by HIV, facing higher rates of infection compared to their white counterparts. This disparity underscores the need for targeted prevention and treatment efforts within these communities. Additionally, transmission rates of HIV can vary dramatically from state to state, influenced by factors such as regional healthcare access, public health initiatives, and social determinants of health. Understanding these variations is crucial for developing effective strategies to combat HIV and support those affected across the nation. State-level HIV prevalence in women. Georgia. The state has reported notably high HIV transmission rates, particularly in urban areas like Atlanta. Factors contributing to this trend include socioeconomic disparities, limited access to healthcare, and a lack of awareness about preventive measures. Targeted outreach programs are essential to address these issues and empower women in affected communities. Florida. Women of color in Florida face a significant impact from HIV, with disparities in both diagnosis and treatment. Various societal factors, including systemic racism and economic instability, exacerbate their vulnerability to the disease. Community-based initiatives that focus on education, testing, and access to care are crucial in mitigating this public health challenge. California. The state has implemented comprehensive prevention programs that have demonstrated positive results in reducing HIV transmission among women. These initiatives include widespread testing, education on safe practices, and access to pre-exposure prophylaxis, OR, PrEP. As a result, California has seen a decline in new infections, showcasing the effectiveness of proactive public health strategies. New York. New York boasts advanced medical support systems which provide extensive resources for women living with HIV. The state's healthcare infrastructure includes robust treatment programs, mental health support, and initiatives aimed at reducing stigma. These resources have contributed to improved health outcomes for women and play a vital role in the ongoing fight against HIV/AIDS in urban populations. Stages of HIV infection. Once a woman is infected with HIV, she will go through the following 3 stages of the disease. Stage 1, acute HIV infection. In the first weeks after infection, women may experience symptoms that mirror a common flu. These include the following: mild to high fever. A fever is characterized by an elevated body temperature, typically ranging from 100.4 deg for 38 degrees to 102.2 deg for 39 deg. This symptom is often accompanied by chills or episodes of sweating. The presence of a fever can indicate that the body is fighting off an infection or illness, signaling a response to pathogens such as viruses or bacteria. Monitoring the duration and fluctuations of the fever can provide critical insights into the underlying cause. Extreme fatigue. Extreme fatigue refers to an intense and persistent feeling of tiredness that does not improve with rest or sleep. Unlike ordinary tiredness from a long day, this sensation can be debilitating, making it challenging to perform everyday tasks such as work, household chores, or social interactions. It may stem from various factors, including medical conditions, sleep disorders, or mental health issues, and often requires professional evaluation to uncover its root cause. Swollen lymph nodes. Swollen lymph nodes appear as noticeable enlargements in areas such as the neck, armpits, or groin. They can feel tender or painful to the touch and may indicate that the immune system is actively working to eliminate an infection. When lymph nodes swell, it often points to underlying health issues, including infections, autoimmune diseases, or in some cases, malignancies, necessitating further examination to determine the specific cause. Persistent sore throat. A sore throat that persists beyond the typical duration associated with viral infections can be a concerning symptom. Unlike a fleeting throat irritation from allergies or a common cold, as a chronic sore throat may last for several days or weeks. This symptom could signal more serious conditions, such as bacterial infections like strep throat, allergies, or even throat cancer. Consulting a healthcare provider is important for a proper diagnosis and treatment. Muscle and joint pain. Discomfort or stiffness in the muscles and joints manifests as an achy sensation that may interfere with daily functioning. This pain can be localized to specific areas or widespread throughout the body, making movements uncomfortable or even painful. Such symptoms may arise from various sources, including physical strain, autoimmune diseases, or chronic conditions like fibromyalgia, and might require medical assessment to determine appropriate management strategy. Unexplained skin rash. The appearance of a skin rash can take many forms, including redness, swelling, bumps, or itchiness, and its cause may not be immediately evident. Such rashes can arise from allergies, irritants, infections, or underlying health issues, and can vary significantly in appearance and severity. It is crucial to monitor the rash for changes and seek medical advice if it persists, worsens, or is accompanied by other concerning symptoms, as proper diagnosis is key to effective treatment. What is so sad is that many women mistake these symptoms for a typical viral infection, making early detection challenging. Stage 2, chronic HIV infection, the silent phase. As the virus settles into the body, women might experience the following: persistent vaginal yeast infections. Frequent episodes of yeast infections characterized by vaginal itching, burning, and unusual discharge, which do not respond adequately to standard antifungal treatments. Recurring urinary tract infections. Regular occurrences of urinary tract infections, leading to discomfort, painful urination, and the need for multiple rounds of antibiotics over a short period. Menstrual cycle irregularities. Noticeable fluctuations in the menstrual cycle, including missed periods, prolonged cycles, or unexpected bleeding, which may indicate hormonal imbalances. Unexplained weight loss. Significant weight loss over a relatively short period without changes in diet or physical activity levels, raising concerns about underlying health issues. Mild but consistent skin problems. Ongoing skin issues such as rashes, dryness, or mild acne that persist despite over-the-counter treatments and appear to have no identifiable cause. Increased susceptibility to bacterial and fungal infections. A tendency to develop bacterial and fungal infections more easily than usual, suggesting a weakened immune response or other underlying health concerns. Are women more at risk of HIV compared to men? Biological factors contribute to a heightened vulnerability of women to HIV transmission in several significant ways. For instance, 1. Larger mucosal surface area. Women have a greater mucosal surface area in the reproductive tract compared to men, which increases the likelihood of HIV exposure during sexual intercourse. This larger area provides more opportunities for the virus to enter the bloodstream. 2. Microscopic tears. During intimate contact, the friction and pressure can lead to microscopic tears in the genitals or cervical tissues. These small injuries can serve as entry points for the virus, facilitating its transmission from an infected partner. 3. Hormonal fluctuations. Women experience cyclical hormonal changes that can influence their immune response. These fluctuations may make certain phases of the menstrual cycle more conducive to infection, as hormonal imbalances can temporarily dampen immune defenses. 4. Increased viral load. Research indicates that HIV viral loads may be higher during specific phases of the menstrual cycle. This increased viral presence can enhance the risk of transmission if an infected partner is involved, particularly at peak times when the risk of infection is heightened. Together, these factors underline the unique biological complexities faced by women in the context of HIV transmission and highlight the need for targeted prevention strategies. HIV influence by hormonal interactions. The hormonal cycles in women can have distinct interactions with HIV, affecting various aspects of the virus and the immune response. For instance, these can include the following: estrogen levels. Fluctuations in estrogen levels throughout the menstrual cycle may influence the replication of the HIV virus. Higher levels of estrogen have been suggested to enhance the susceptibility of women to HIV infection and may also impact the viral load in those already infected. Progesterone's role. Progesterone may play a significant role in modulating immune cell functions. It has been suggested that variations in progesterone levels could affect the immune system's ability to respond to HIV, potentially altering the effectiveness of the immune response in controlling the virus. Impact of menopause. The transition to menopause brings about hormonal changes that can have implications for HIV progression. The decline in estrogen and other hormones may alter the rate of disease advancement in postmenopausal women, possibly affecting the overall health and immune status of individuals living with HIV. These interactions underscore the complexity of HIV management in women and highlight the importance of considering hormonal status in treatment and care strategies. Specific HIV signs unique to women. In addition to the common symptoms associated with HIV, women may encounter a range of specific health challenges linked to the virus. These may include pelvic inflammatory disease, or PID. Women living with HIV may develop PID, a serious infection of the reproductive organs. This condition can be particularly problematic as it often does not respond to standard antibiotic treatments, leading to chronic pain, infertility, and increased risk of further complications. Human papillomavirus, or HPV, infections. HIV-positive women are at a heightened risk for more severe and aggressive forms of HPV. This sexually transmitted infection can cause warts and is associated with various cancers, including cervical cancer. The combination of HIV and HPV can complicate treatment and increase the chances of persistent infection. Accelerated cervical cell changes. Women with HIV tend to experience faster progression of cervical cell changes, which can be precursors to cervical cancer. Regular screening is crucial for early detection and management of these changes, as they can develop more rapidly in individuals with compromised immune systems. Increased risk of reproductive health complications. The presence of HIV can lead to a range of reproductive health issues, including complications during pregnancy, such as preterm birth and low birth weight, Furthermore, women may have higher rates of other sexually transmitted infections and experience greater difficulties in managing contraceptive needs due to their altered health state. Overall, it's essential for women living with HIV to maintain regular health checkups and screenings to address these specific risks effectively. HIV gynecological red flags. To increase on the possibilities of HIV infection, women should pay special attention to persistent vaginal infections resistant to standard treatments, abnormal pap smear results, unexplained fertility challenges, and recurring sexually transmitted infection symptoms. Advanced HIV stage recognizing AIDS development. As HIV advances to the stage of AIDS, women may encounter a range of significant health challenges, including dramatic weight loss. This can occur due to a combination of factors, including a decrease in appetite, increased energy expenditure, and the body's inability to absorb nutrients effectively as the immune system deteriorates. Or a thrush. Persistent white patches may develop in the mouth, indicating a fungal infection caused by an overgrowth of candida. This condition can lead to discomfort, difficulty in swallowing, and can also be a sign of a weakened immune response. Severe and recurring pneumonia. Women may experience frequent episodes of pneumonia, particularly pneumocystis pneumonia, or PCP, which is a common opportunistic infection in individuals with AIDS. Symptoms can include cough, difficulty breathing, and chest pain. Profound immune system breakdown. As the disease advances, there may be a significant decline in the number of CD4 T cells, which are crucial for maintaining a healthy immune response. This breakdown makes the body increasingly vulnerable to infections and other diseases. Neurological symptoms. Some women may experience neurological complications such as confusion, memory loss, or other cognitive impairments. These symptoms can arise from HIV-related brain infections or inflammation, impacting daily functioning and quality of life. These changes reflect the severe impact that HIV/AIDS can have on a woman's health, emphasizing the importance of early diagnosis and continuous medical care. HIV testing and early detection. HIV testing for women encompasses several important methods designed to detect the virus and ensure timely medical intervention. These methods include antibody tests. These tests check for antibodies that the body produces in response to HIV infection. They are typically performed using blood samples or oral fluid and can indicate an infection that has occurred within the last few weeks to months. RNA/DNA tests. These are more advanced tests that detect the actual virus in the blood. They can identify HIV earlier than antibody tests, often within days of infection, making them crucial for early diagnosis and treatment. Combined antigen-antibody screenings. This type of test can simultaneously detect both HIV antibodies and the P24 antigen, which appears in the blood shortly after infection. This combination approach improves the accuracy and speed of diagnosis. At-home testing options. For those seeking privacy or convenience, there are various at-home testing kits available. These allow individuals to collect a sample and send it to a laboratory for analysis or to test themselves using a finger prick method, providing results privately and efficiently. With these options, women can take proactive steps in managing their health and ensuring they receive the necessary care if needed. HIV window period. Most tests are accurate 10 to 33 days after potential exposure. Current HIV research and hope. Leading HIV research centers in the United States are making significant advancements in the field. Notable efforts include NIH, or National Institutes of Health, engaging in innovative research focused on gene therapy approaches to combat HIV. Johns Hopkins University, developing targeted treatment strategies aimed at improving patient outcomes. UCSF, or University of California, San Francisco, investigating mechanisms of HIV progression that are specific to women, shedding light on unique challenges and solutions. HIV prevention strategies tailored for women. Comprehensive HIV prevention includes regular sexual health screenings, pre-exposure prophylaxis, or PrEP, understanding personal risk factors, open communication with healthcare providers, protection during intimate encounters, a personal story of resilience. Maria, a 35-year-old nurse from Atlanta, discovered her HIV status during a routine checkup. Through immediate medical intervention, comprehensive treatment, and unwavering determination, she transformed her diagnosis into a journey of advocacy and hope. HIV final thoughts. Knowledge is empowerment. HIV in women is not a story of limitation, but of incredible human resilience. Every symptom, every medical test, every moment of uncertainty is an opportunity for understanding, treatment, and ultimately thriving.